So you've got pain that radiates down your leg. It's really uncomfortable, it's sore. You've been told it's sciatica, right? Well, not necessarily. Because in this video, I'm going to explain how there is a difference between certain types of leg pain. It's not necessarily sciatica. It can be something called referred pain. So now when it comes to sciatica, yes, there is pain that radiates down your leg, but it's caused specifically by a compression or irritation of the nerve root. Now the nerve root is the point where the nerve just comes out the lower back. So we have a gap in between each vertebral level, and next to it is the intervertebral disc, and that's normally our culprit. But this particular small bit of the initial part of the nerve as it comes off the spinal cord is the nerve root, and so irritation to that area can cause quite unpleasant symptoms that radiate down your leg. But not every pain that radiates down your leg is because of compression on that nerve root. There is a difference between nerve pain and experience of nerve symptoms and nerve root sciatic pain. Now, referred pain is something where you have an irritation to a structure in your body around your lower back or pelvis, but the experience of that pain is being perceived by your brain as being from somewhere else. So this is manifesting itself in leg symptoms. So a lower back irritation or an irritation to a facet joint or muscular pain, anything like that, can cause pain to be perceived elsewhere. And if you think about it, when somebody has a heart attack, one of the symptoms can be that they have pain down their arm. Now, there's nothing wrong with their arm at all. There is no pain, no problem with their shoulder, no problem with their elbow, but the pain is being felt and perceived by the brain as coming from down the arm. This is a great example of how referred pain can be experienced and how it's about a brain perception thing that is causing that symptom. Now let's look about the difference between those two types of pain, shall we? So let's start with the sciatic pain caused by nerve root irritation. So sciatic nerve root pain often produces a sharp shooting pain in the leg. It often results in quite a distinct line of pain down the leg. Now it might be that only certain parts of the leg are hurting, but they are quite sharp and they're quite uncomfortable. Now, referred pain symptoms can be quite similar. They are often felt in the leg, but they can often be quite diffuse compared with that sharp pain related to nerve root pain. Diffuse pain is difficult to localize and it can move around a little bit as well, and often it can be felt in both sides, in both legs to a certain degree. And it's not common for a nerve root pain to be experienced in both legs. In fact, that's a sign that things are pretty bad if you get nerve root pain radiating down both legs. But diffuse, achy pains in both legs is not a sign of something that is terrible. Key determinant of whether you have nerve root pain can be to do with the fact whether you have neurological symptoms or not. Now, neurological symptoms are things like sensation changes, pins and needles, numbness sensations, and particularly a loss of power like foot drop, where you actually can't physically lift a limb up at all. Now, with referred pain, you don't tend to get many, if any, neurological symptoms. Sometimes there's a bit of a numb area or tingly area. Sometimes it feels weak, but it's not a profound weakness. It's not a drop where you would just not get that with referred pain. So with sciatic pain from nerve root origin, you would tend to get more profound neurological symptoms, whereas with a referred pain, minimal neurological symptoms. Now, the important part to remember about this is that referred pain is by far the most common presentation of symptoms of pet leg pain rather than sciatica caused by nerve root pain. This is good news because when you have a problem with your disc, which is often the cause of a sciatica, true sciatica pain, is that often takes a lot longer to solve than if you have referred symptoms. So it's a better scenario really to have referred symptoms rather than sciatic nerve root pain. In terms of treating these problems, There isn't a great deal of difference actually between what we do treatment-wise for getting both these problems better. However, the sciatic symptoms, as I say, can take a little bit longer. If you want to know more about what you can do to get started if you have referred pain or sciatic symptoms, then you should watch this next video about getting comfortable.